Hi everyone, and welcome to our second module on skin disorders. Let's start by talking about erythema nodosum. This is an example of a type 4 hypersensitivity reaction, meaning it is basically an allergic reaction in which the body attacks itself. It's a form of paniculitis. Paniculitis means inflammation of fat, and in this case it's the subcutaneous fat in the skin. So by way of review, the skin has an epidermal layer on top, and then next it's got the dermis, and then below that it's got the subcutaneous fat. And this is the layer that becomes inflamed due to a hypersensitivity reaction in erythema nodosum. Often this disorder is idiopathic, but there are a number of triggers that can potentially lead to this. These are all things that ramp up the immune system, potentially causing a hypersensitivity reaction. So infection is the most common trigger. Usually it's a strep infection. This can also be triggered by Crohn's disease in some cases, and there are many people in whom an episode of erythema nodosum precedes a flare. So they will develop this skin disorder, and that means that they're about to get a flare of their Crohn's disease with GI symptoms. And then erythema nodosum is also associated with sarcoidosis and coccidiomycosis, the fungal infection. Erythema nodosum causes painful red nodules on the skin, most commonly in the shins. This is a picture of someone with erythema nodosum on the screen here. On the right, I've zoomed in on a lesion. And the word painful is key. So there are other things that can look like this, but they tend to be itchy or have other clinical findings. If a person with one of the triggers I talked about in the last slide has an eruption of painful red nodules on their shin, erythema nodosum is one of the things you should think about. The classic pathology finding on biopsy is septal paniculitis. So let's talk about what this means. Paniculitis, as I told you, means inflammation of the fat. And in this case, it's inflammation of the septa of fat between the dermis and the fascia. So if you look at this picture on the screen here, these white lobules are fat. What's inflamed are the septa in between the lobules, not the lobules themselves. That's called septal paniculitis. And this is in contrast with lobular paniculitis, where the fat lobules are inflamed. That occurs in other disorders. Our next disorder is lichen planus. This is a rare chronic inflammatory skin disorder, and if you don't know this, the word lichen means tree moss. This is a picture of a tree with lichen on it, and the word planus means flat. So this disorder gets its name because it is a flat skin lesion that reminds people of tree moss. It occurs in adults. The pathogenesis is unknown, and it resolves spontaneously, although it takes years. And in terms of board purposes, you should know that this is classically associated with hepatitis C. This will often be described in a patient who has chronic hepatitis C infection. Many books will tell you that the symptoms of lichen planus can be remembered by the 6 P's. Those P's are pruritic, purple, polygonal, planar, papules, and plaques. Personally, I've never found this that helpful. How I always remember this is that these are purple, flat lesions that are very, very itchy, often intensely itchy, and this is a key clinical finding, especially in board questions. Like I told you before, erythema nodosum and other disorders can be painful. In the case of lichen planus, it will be itchy. The lesions tend to be multiple and symmetric. They're often on the arms, legs, or wrists. The wrists and ankles are classic sites. And this is a picture of someone who has lichen planus on the screen here. It's not very distinct. This looks like lots of other skin lesions. The way you're going to recognize this in a board question is that it will probably be in a patient with hepatitis C, and it will be very, very itchy. Some other clues that can help you recognize this disorder in a board question are that it often has mucosal involvement, often in the mouth or on the tongue, sometimes on the glans penis. This is a picture of someone with mouth involvement. And if you look closely at the lesions in lichen planus, you can see these white dots or lines. They're very easy to see in this picture on the screen here. Those are called Wickham striae, and they're caused by hypergranulosis, which is a classic feature of lichen planus that I'll talk about in a minute. The striae are often best seen on the oral lesions, like in this picture on the screen, although if you look closely at the skin lesions, you can sometimes see them as well. So once again, in a board question, if they describe these white dots and lines of Wickham striae, you should think of lichen planus. Let's talk about what you would see under the microscope if you did a biopsy of a lesion of lichen planus. First of all, what you would see are lymphocytes at the dermal-epidermal junction. This is the dermal-epidermal junction here, and you find lymphocytes there in a lesion of lichen planus. Second important finding is hyperkeratosis. That's increased thickness of the stratum corneum. Lichen planus is the classic disorder to cause hypergranulosis, and I talk about this in more detail in the video on the skin, but hypergranulosis is increased thickness of the granular layer of the epidermis. And then finally, a classic finding in lichen planus is the so-called sawtooth pattern of the reet ridges. Reet ridges are these portions of the epidermis that dive down into the dermis. They're between the dermal papillae, like this one here and this one here. And you can see that these form sawtooths, like this one I'm marking with my pen. And this is called the sawtooth pattern of the reet ridges seen in lichen planus. Moving on, let's talk about pityriasis rosea. This is an acute self-limited skin rash. People with this disorder have an eruption of skin lesions that is self-limited and usually goes away in about 2 to 3 months without any treatment required. The cause is unknown, but it's believed to possibly be caused by a virus. Pityriasis begins with a skin finding called a herald patch. This is a single red salmon-colored lesion that is round or oval and well demarcated, usually on the chest, neck, or back. This is a picture of one right here on the screen. This is a herald patch here in the middle of the image. Days later, multiple lesions develop on the trunk. These are similar to the herald patch, but they're smaller. They're usually grouped together, and they follow the lines on the skin. And since the lines on the skin, especially on the trunk, like for example on the back, tend to go like this, it is said that these lesions tend to form a Christmas tree distribution. So here's a picture of the back of someone with pityriasis rosea, and you can see these red lesions here, and they tend to follow lines like this going down this person's back on both sides, and so people think this reminds them of a Christmas tree. So the classic example of this in terms of board exams is someone who has a herald patch followed by multiple lesions on their back or trunk in a Christmas tree pattern. It's self-limited and usually resolves in a few months without treatment. Now let's talk about thermal skin burns. So skin burns were traditionally classified as either first, second, third, or fourth degree. Nowadays they're often classified by the layers of the skin that are involved, so I'll describe them using both terminologies. First degree or superficial skin burns involve only the epidermis. These tend to be painful and red, like this picture shown on the screen here. In addition, they blanch with pressure, so the reason these are red is because there's more blood flow to that area of the skin. So when you put pressure on that area of the skin, you cut off the blood flow and the lesion blanches, meaning it becomes white. That's a classic feature of first degree burns. There have to be no blisters present. If blisters are present, it's not a first degree burn, and these generally heal within about a week. A second degree partial thickness burn also involves the epidermis but some of the dermis, and it looks a lot like a first degree burn. This is one on the screen here. This red part here looks just like a first degree burn, but blisters are present, and once there's a blister present, it becomes a second degree burn. The red part is painful just like first degree burns, and it blanches with pressure just like first degree burns, and these also heal, but it takes a little bit longer for them to heal. Full thickness burns, which used to also be called second degree burns, involve the epidermis and most of the dermis. These burns look like what's shown on the screen here. They are yellow or white, and they are painful to pressure only, and that's because many of the nerve endings have been damaged. They do not blanch because blood flow to the area has been disrupted. That's why they tend to be yellow or white, and the color doesn't change when you press on it. And these types of burns will heal, but there will be scarring after they heal. And then third degree or fourth degree burns are also full thickness burns. Third degree burns involve the entire epidermis and the dermis. This is a picture of one shown here. Fourth degree burns also involve the superficial fat. These are very serious injuries. They often require surgery or skin grafts. I'll finish by talking about sunburn. Sunburn is a delayed inflammatory response of the skin caused by ultraviolet radiation, usually from the sun. It's a delayed response, meaning that you're exposed to the sun, but you do not develop the inflammation until a number of hours later. And there are two forms of UV radiation. The first type is called UVB radiation. The reason it's called UVB is because it has a wavelength from 280 to 320 nanometers. The second type is called UVA radiation. This has a longer wavelength, 320 to 400 nanometers. Both may cause sunburn, but UVB range is the most effective at causing sunburn. This is something high yield for you to know for your boards. It's usually the UVB range radiation that is most damaging to our skin. This is a picture of a man with sunburn on his chest shown on the screen here. Many of you have probably experienced this in your own lives. In sunburn, there's damage to both the epidermis and the dermis. The UV radiation causes DNA damage, and this leads to apoptosis of skin cells followed by inflammation. You can see under the microscope sunburn cells. These are keratinocytes that are actually undergoing apoptosis. They're characteristic of sunburn. In addition, there's vasodilation. This is some of what leads to the warmth and the redness. There's also release of inflammatory mediators. And as you may know, if you've ever had a sunburn, this is self-limited. It usually goes away in a day or so. And that concludes our second video on skin disorders.